GNMI Medical Imaging in Mississauga. Community surgical and diagnostic centers, formerly known as independent health facilities, play a key role in Ontario's publicly funded healthcare system, providing greater than 50% of all outpatient diagnostic imaging services. GNMI is one of the largest volume providers of diagnostic imaging services through GNMI MRI and CT, Greater Niagara Medical Imaging, and Maryville Medical Imaging. We also provide radiology services and support 9 Ontario hospitals through GTR teleradiology. At this Mississauga facility, we have 3 MRIs and 1 CT and see over 250 patients per day operating 7 days a week. Through state-of-the-art technology and subspecialty reporting, the community is benefiting from access to high-quality radiology services. We are proud to serve Ontarians and do our part in mitigating wait times for diagnostic imaging services, and in doing so, helping to facilitate surgical and treatment planning. And now, I'd like to turn things over to our Minister of Health and Deputy Premier, the Honorable Sylvia Jones.
Well, thank you very much, Dr. Patel, and good morning, everyone. It is indeed a pleasure to be here and to talk about the next steps as we move forward on our community-based diagnostics servicing patients. I want to talk about our government's next step in implementing Your Health, a plan for connected and convenient care to further reduce wait times for surgeries and diagnostic procedures. Thank you for hosting us today, and especially to Drs. Patel and Shah for all you do every day to help decrease diagnostic imaging wait times across Ontario. I also want to acknowledge and thank Leslie Thompson, CEO of Accreditation Canada, for joining us today. When it comes to surgical wait times, our government will not accept the legacy of years of inaction by the previous government that led to too many people waiting too long for care. Instead, we are taking bold action to expand community surgical and diagnostic centers so we can reduce wait times by doing more surgeries in state-of-the-art, convenient, and safe facilities, which will always be paid for by your OHIP card, never a credit card. A key part of this plan is increasing the number of procedures that happen in our community surgical and diagnostic centers. For over 30 years, community surgical and diagnostic centers have been a part of Ontario's publicly funded healthcare system, providing a range of services covered by OHIP. And with more than 300 centers currently operating throughout the province. To build on the progress we've made through our Your Health plan and further connect Ontarians to timely surgical and diagnostic care, I am pleased to announce that beginning in spring of 2024, we will be expanding the number of licensed community surgical and diagnostic centers to deliver additional OHIP-insured services, including more MRI and CT scans, GI endoscopies, and orthopedic surgeries. We've been clear all along that any expansion to community surgical and diagnostic centers must be thoughtful, and these centers should be held to the same accountability and standards to provide the same level of care as our hospitals. This is why I am also pleased to announce that today our government is proposing changes that would name Accreditation Canada as the inspection body responsible for ensuring the highest quality standards and strong oversight of our current and future community surgical and diagnostic centers across Ontario, effective April 1st, 2024. We are very proud to partner with Accreditation Canada, who will lead the development of an enhanced oversight and quality assurance program that has the same strong requirements as public hospitals to ensure consistent patient safety and quality health care. They have been a national leader in this space for over 65 years, and we are grateful for their partnership as we move our plan forward. While we are just hitting the one-year mark since our Your Health announcement, we are making steady progress on the implementation of some key parts of our plan. A plan that is bold and innovative. A plan that is working. Under the leadership of Premier Ford, Ontario saw the shortest surgical wait times of any province in Canada in 2023, reducing the surgical wait list since its peak in March of 2022 and resulting in 16,000 fewer people waiting for the surgeries they need. We've also eliminated the backlog of surgical cancer screening tests at the end of August 2023. And we saw completion rates of pediatric surgeries reaching 112% pre-pandemic levels as of December 2023. And we are increasing diagnostic imaging capacity by an additional nearly 100,000 MRI and over 115,000 CT operating hours. These changes mean that Ontarians are getting earlier diagnosis and receiving treatment sooner so that they can get back to their regular lives with their families and their loved ones. The Liberals' inaction, supported by the NDP, led to the longest healthcare wait times in Ontario's histories. We must remember that they fired healthcare workers, froze healthcare funding, and cut medical school positions. Under Premier Ford's leadership, our government will continue to make bold and creative changes to build a healthcare system that works for you and your family. By working collaboratively with our partners across the health sector, we are making Ontario a place for people to conveniently connect to the care they need closer to home. Since 2018, we've added more than 80,000 nurses, with another 30,000 current nursing students studying in Ontario. We've added over 3,500 hospital beds, with another 3,000 on the way. And our changes have allowed pharmacists to do more than 650,000 common ailment assessments for people more conveniently closer to their homes. Thank you again to everyone across the healthcare sector and our incredible front care healthcare workers for helping to build a stronger, patient-centered healthcare system and ensuring Ontarians are provided with a better healthcare experience now and for decades to come. Thank you and stay well. It's now my pleasure to pass it over to Leslie from Accreditation Canada to say a few words.
Thank you, Minister. Thank you very much, Minister Jones and Dr. Patel. On behalf of Accreditation Canada, I am delighted to be here today as part of this important announcement. We are very proud to be chosen by the Government of Ontario to support this plan for reducing wait times for surgeries and diagnostic procedures. We are looking forward to collaborating with the Ministry and stakeholders around the province to develop and deliver a high-quality oversight and assessment program that will support over 900 of the current and future community surgical and diagnostic centres. Accreditation Canada is an independent, not-for-profit organization with over 65 years of experience and expertise. In affiliation with Health Standards Organization, we set national standards for quality and safety, and Accreditation Canada conducts rigorous external assessments using evidence-based methodologies with well-trained peer surveyors to ensure those quality and safety standards are met. As the largest, most comprehensive provider of accreditation services in Canada, our standards and programs are used in over 12,000 locations. That's in every hospital and health system across Canada and across 40 countries. We will be drawing on all of this experience and expertise to serve the people of Ontario with the program the Minister has announced today. The Ministry and Accreditation Canada are aligned in our partnership goal to develop and uphold rigorous standards aimed at ensuring quality and safe care for all Ontarians. This program is not starting from scratch. It builds on the successful assessment program that has come before us under the leadership of the College of Physicians and Surgeons of Ontario and on the long-standing hospital accreditation programs. Going forward, Accreditation Canada will transition the quality and safety program, which is excellent under the CPSO and consistent with new legislation and regulations, expand the program to include many of the same rigorous requirements we have in our Ontario public hospitals. Consistent across all centres will be the need to meet a set of stringent requirements that ensure the delivery of safe, high-quality care. Moreover, the program will instill a culture of continuous quality improvement and learning, fostering an environment where healthcare providers are dedicated to the latest advancements and have access to best practices. Accreditation Canada will conduct the assessments of the centres with trained peer surveyors to determine the extent to which they meet the standards and criteria laid out in the program. And consistent with the legislation, reports will be public and steps will be taken to address any gaps or nonconformities. As always, we are committed to a process of engagement, and we look forward to collaborating with our many health sector partners, patients and families, and healthcare professionals in the development of the most robust quality oversight and assessment program that will take us into the future. The partnership between the Ministry of Health and Accreditation Canada acknowledges the pivotal role these centres play in our healthcare landscape and the need to ensure that they meet or exceed the highest standards of care. It also signifies a shared commitment to our healthcare system, one that prioritizes the well-being of patients first and places a premium on quality, safety, and continuous improvement. Thank you.
We'll now move to take questions from the media. If media present could kindly form a line behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Ms. Jones, it's Richard Southern from City News. How are you today?
Good.
ER wait times are in Ontario the worst they've ever been by all accounts. Two things. What is your plan today to fix this issue? And will you release today the current January average ER wait times, Minister?
So, Richard, you know that we have made a number of investments with our hospital partners to make sure that they have the resources that they need. This is not a money investment conversation or challenge. It is making sure that we have sufficient health human resources out in our communities to serve our communities. We have done that by, in the short, medium, and long term. Long term, of course, we have expanded the number of not only nurse positions, lab technician positions in our schools, paramedic positions, and of course, physicians. So we are preparing for the decades to come to make sure that we have sufficient health human resources, something respectfully I wish that previous governments had been doing instead of what the Liberal government did at the time, which was, of course, cut residency positions in Ontario. So we're doing that in preparation for the longer term. In the shorter term, of course, in July, we made an investment of $330 million in pediatric care. What that has done is, as we've seen similar numbers in our pediatric patients and challenges, we have now hospitals with capacity to make sure that they can serve those patients. We're doing all of this work very closely with Ontario Health and health hospital partners, with input from them saying, if we did this, this will make the difference. You know, we talk about dedicated offload nursing program that didn't exist previously, that allows individual hospitals to hire nurses, paramedics, or respiratory technicians to look after and take care and control of patients so that paramedics can get out on the road faster. All of these programs are as a result of conversations and input from our hospital partners, and we'll continue to do that. The work is not done.
Before I move on to my follow-up, I didn't catch. Are you going to release the current wait times?
I'll have to follow up on that. Sorry,
Okay.
Richard.
For my follow-up, I'm asking you this as in your capacity as Deputy Premier, since the Minister in charge of this file isn't getting back to us. How many taxpayer dollars is the government giving to Staples and Walmart to install Service Ontario kiosks? Why was the deal not sole sourced, and did you approve it in Cabinet?
So, first of all, that program is going to save taxpayers $1 million every year, year over year. We are offering more convenience for individuals who want to and need to use the services of Service Ontario. I remember, and I'm sure many of you remember, the long, long wait times and the long lineups that we had to endure at our Service Ontario facilities. We are making it more convenient in the same way that we have made it more convenient for individuals to access minor ailments in our pharmacies. We are doing the same thing with Service Ontario kiosks. We already have them in Canadian Tire and in Home Hardware, and we'll continue to talk to our municipal partners to find out where we can site these locations that are convenient for the people. We don't need to only have government services available Monday to Friday, 9 to 4, 9 to 5. We can have more access, more convenience if we push them out and have partnerships like we do with Canadian Tire and Home Hardware.
Why sole source? Why sole source? How much money? Why sole source, Minister?
It's one question, one follow-up.
Yeah. Well, why sole source, Minister?
$1 million savings per year, Richard.
Okay. Hi, John Woodward from CTV News. I want to follow up a bit on the ER side of the things that Richard was saying. In a case that we've raised already with your staff, an 84-year-old woman who was deaf, had dementia, was admitted to the ER at Michael Garron Hospital, and she had an issue, and a security guard responded and put her in a headlock and quite severely injured her. I wanted to ask if we really are at the situation now where the ERs are so busy, they're calling security guards to respond to patients instead of nurses and doctors.
Listen, we have emergency department and clinicians working in emergency departments under very challenging circumstances. As you know, an emergency department is the area of last resort for people, and they are often in distress and confused and concerned. So when we see that there are interactions that may endanger members of the staff or other patients who are accessing those services, then hospitals have to take those responsibilities seriously, and in some cases there are interactions as you raise. But it is in no way to suggest that we are finished making the investments and working with hospital partners to ensure that they have all of the tools they need. You know, we haven't touched today on all of the investments we're making on mental health and addictions. Part of that is to ensure that people don't only have to go into an emergency department when they're in crisis. We're making sure that we have more robust community services available so that they don't automatically and only have to go to an ED. Specifically related to the issue that you raised, I think it would be more appropriate to raise that with Michael Garron Hospital.
Okay, and on the oversight front, specifically with regards to Accreditation Canada, they provide oversight for Michael Garron Hospital on this specific issue. And we did go to them asking for details on the accreditation, other things. We were actually denied information, and we were actually sent back to the hospital, who didn't answer our questions there. So with that experience, how can we have confidence in Accreditation Canada's handling of this expansion if when they're faced with serious questions about a serious incident, that's the response we get?
So individual issues that occur within a hospital setting, which is an independent corporation with a board that has responsibility for oversight, should be dealt with at the hospital level. Accreditation Canada has, as we mentioned, decades, over 65 years of experience accrediting healthcare facilities, not only in Ontario, but in fact across Canada. And what we wanted when we were expanding our community and surgical diagnostic tenders is to give patients the confidence that whether you are having that service provided in a community setting or in a hospital, you will have the confidence of the same level of accreditation, the same level of safety, the same oversight that you would have, and you will, of course, always be using that, accessing that service with your OHIP card.
Okay, next question. Thank you.
Hi, Minister. Laura Stone, Globe and Mail. Just on the oversight mechanism, can you explain why you went with Accreditation Canada as opposed to the College of Physicians and Surgeons, and how long you think it will take for the oversight system to get up and running if you're only kind of doing consultations now?
So a lot of the conversations have happened. We have obviously been working with CPSO. They have incredibly important work that they are doing on the physician level. As you know, when I issued a director's directive to the CPSO to quickly assess, review, and when appropriate, license internationally educated medical grads. That work is ongoing, so they will continue to do much of the physician-related piece that is so important to talk about some of the health human resources that have already been raised this morning. Specifically in terms of timing, of course, April 1, 2024, not only will the transfer of the existing community diagnostic centers move over to Accreditation Canada, but as we move forward on licensing additional, Accreditation Canada will play that role. I don't know if you had any more you wanted to share.
Thank you, Mr. Really, the only thing to add would be that the nature of the program is more comprehensive than the specific physician oversight. Quality and safety requires a full team effort, and the quality and safety practice procedures, the request is that they are held to the same standards as hospitals, which we accredit today. Thank you.
And just as a follow-up, Minister, on the ER wait times, I think, you in your answer to Richard, you sort of kind of detail what you think the government's doing and about how to make it better, but there's reports of people waiting more than 12 hours, up to 40 hours in some instances in emergency departments. Do you acknowledge that that is just unacceptable in our province?
Absolutely. What I want to see is to have the hospital have the ability to, for example, immediately, when appropriate, actually make that patient transfer into the hospital. So some of those wait times, you have to drill down into why the timing is that way. All patients are being triaged when they appear in an emergency department. Some of the wait times absolutely are concerning, but some are because they are waiting for a hospital bed to become available within the facility. So again, you have to look at the entire infrastructure, which is why we made changes with long-term care and our hospital partners to make sure that ALC, alternative level of care patients who are in a hospital bed and would be better served in community, whether that's in a long-term care facility or some other healthcare facility, are able to transfer out of that hospital so that we do have the space and the availability to make sure that that emergency department patient who is waiting for a bed can quickly get there.
Hi, Minister. Mirna Djukic for Radio Canada. I'd just like to get some numbers, some dates on the expansion of the use of community clinics. You say spring 2024, but how many clinics and what is the schedule on hip and knee replacement surgeries to be added to the mix?
So as you know, in Ontario right now, we already have 900 community surgical diagnostic centers operating in the province of Ontario. Our focus in the first expansion will be on hips and knees, and we will continue to monitor where the highest wait times for diagnostic or surgery is to make sure that as we plan out the expansion, we are very laser focused on making sure that we get the services in the communities that have the highest wait times and have the highest need.
In December, through a FOIP request, we got some details on the contracts with the Dunn Mills surgical units that shows that for the same surgeries, it costs 2 to 3 times more to the government to make it in private and community clinics than it would in a hospital. So I'm wondering if you can respond to the criticism that this is not the most effective or the most cost-effective way to reduce wait time.
Listen, we know that we cannot continue with the status quo and have people wait and languish on waiting time, on wait lists, whether it is for diagnostic or surgery. We know that as you get the diagnostic faster, you end up being able to get pathway to treatment faster, and we cannot do all of that relying exclusively on our hospital partners. We've already talked today about how they are dealing with some very important challenges that only they can do. So in the same way that we've expanded the minor ailments and availability in pharmacies, we are pulling away and pulling out some of the procedures that happen in a hospital that can very safely, very effectively, very quickly happen in community. And we can get that done faster as we move forward with the expansion. And again, I want to remind people, 900 of these community and diagnostic centers already operate in the province of Ontario, where people use their OHIP card to get that service and get their pathway to treatment.
This will be the last question.
Hi, Minister. Morgan Bachnick, Toronto Star. There's been a rise in for-profit telehealth companies charging people $100 or more to see a nurse practitioner to get a prescription, which would otherwise be illegal to charge under OHIP if they were a doctor. Ontario doctors have called this bad medicine, profit-driven, and not in the interest of the patient. What is the province doing to address this?
So nurse practitioners are a very important part of our entire healthcare system. As you know, we have an expression of interest that went out in spring of last year, and it will expand primary care multidisciplinary teams. So those are the teams that include the physician, the nurse practitioner, the dietitian, all of the pieces that make sure that the individual patients are getting the appropriate service. We have had many conversations and ongoing conversations through the OMA negotiations on when it is appropriate to use telemedicine and when it is more appropriate to see a physician or a primary care practitioner in person. Those negotiations are ongoing, so I'm not going to make any further comment on that. But I want to be able to use and have nurse practitioners in the same way that we have had conversations on scope of practice with many other clinicians on what is appropriate for them to be doing, what are they properly trained for, and how can we make sure that they work together in those multidisciplinary teams, and those are the expansions that are coming very shortly.
And in October, in response to an Ottawa clinic planning to charge patients an annual $400 fee to see a nurse practitioner, your office said it was investigating and would close loopholes. What specifically has been done to prevent these sort of charges?
So my understanding is that clinic never opened, and the Ministry of Health has and continues to investigate to make sure that what was being proposed in that facility was within the Canada Health Act and under the federal government.
Thanks. That concludes our media availability. Thank you, everyone, for coming.